Good morning, members. My name is Nancy Wangari, a member of Group 5 member. We are going to start our practicals today. And we are going to do the cleaning of the sick room. My admission number is 2024 158912. So these are the cleaning equipment we are going to use. Number one, I have my Cornish brush here, together with the yellow duster. You will use it for high dusting. And then I have my soft broom here. You will use it for sweeping the room. I have my dustbin here. After sweeping, you put your dirt here. We will use this one as our basin, which we will put to do the damp dusting. I have my brush here. We can use this to clean the skirting. With me, I have my hard brush here. We can use to do the scrubbing. And then I have my squeegee here to remove the excess water. I have 4 mop buckets here and 4 mops. We will use them for cleaning. And then I have these buckets here for putting the dirty water. With me, I have my cleaning materials here together with agents. So I have this one. We will use it to do the cleaning of the toilet. It's called Happy. And then I have Vim here, also for cleaning. I have Furnish here. This one you will use it to do the polishing of the furnitures. And then I have the liquid detergent. This one you put it in your water when we are doing the cleaning. We will use the window cleaner here to do the cleaning. And then I have several dusters here. We will also use them to do the cleaning. So I wish you all the best as we clean the sick room. And let's cooperate and let's work as a team. Thank you.
Hello, I am Lydia Wanjikongigi, admission number 2024 HM 15 158 618, group 5 member. I am going to demonstrate on how to clean a mirror in a sick room. That's why I have the appropriate PPEs to protect myself from getting infected. So I'm going to start by dusting the mirror using a dry I'm going to start by introducing my cleaning materials and agents. So I have a window cleaner for cleaning the mirror, a disinfectant, and then I have a dry yellow duster for dusting the mirror, and 2 cloths for cleaning the mirror. I have the papers which I'm going to improvise as the newspaper to buff the mirror to give it a shiny appearance. So I'm going to start by dusting my mirror from top to bottom using circular motion to remove any dust. So this is going to help me to dust every spot. After dusting the mirror, I'm going to disinfect it using a clean cloth and the disinfectant. I'm going to apply the disinfectant on the clean cloth and apply it onto my mirror from top to bottom, so using circular motions. After disinfecting my mirror, I'm going to clean it using a cleaning cloth and the window cleaner. I can choose to spray the mirror directly or spray the cloth and clean it. So I'm going to spray. Sorry. So I will just put the cleaner on my floor and clean the window at the glass mirror from top, also from top to bottom, using circular motion to ensure that I cover every spot. So I'm going to check if that every spot, if there's any spot that is dirty, and clean it. After cleaning my mirror, for me, I'm going to buff the mirror using the papers. You can also use the old newspapers to buff for a shiny appearance. So after finishing, I'm going to check if there are any spots. So I'm going to step back and look at the mirror to ensure that it's well back. I see that the work is well done. Thank you.
Admission 2024 HM 158373. I'm going to demonstrate on how to wash a wooden service. I'm going to introduce my equipment and materials that I'm going to use. Here I have dustbin. I have 3 water buckets.
for warm water, warm soapy water, warm plain water, and for cold water. In materials I have wood polish, detergents, and metal polish. I have a yellow duster, and I have gloves. First, I'm going to use warm soapy water. You wash it, you clean it systematically with warm soapy water to remove stubborn stains. Secondly, you rinse with warm plain water. To remove traces of soap on the surface. Thirdly, you use cold water to refreshen the surface. Finally, you use wood polish. You apply wood polish on the surface to enhance the appearance of the surface. Thank you.
I will be, admission number is 2024 HM 157-839. I will be demonstrating on how to clean the floor. First, I have my tools and equipment used in cleaning the floor. I have warm soapy water. Second is warm water. Third is cold water. I have moppers, 2 moppers, one for cleaning and the next one is for drying. I have broom for sweeping. I have dustbin for collecting dust. And then I have some detergent, which is, here is my detergent, which is liquid soap. Then I have disinfectant. Being a sick room, I have to use disinfectant. Then the first procedure, I will start by sweeping from the farthest end towards the door. This is my farthest end towards the door. Then after sweeping, I will collect my dust and place in the dustbin. Okay, after sweeping the floor, I start by mopping. I will add disinfectant in warm soapy water to disinfect the room, being a sick room. Starting from the farthest end towards the door. Being a tiles floor, we have to only mop. We don't have to scrub. Systematically to make sure the floor is clean. Then after mopping, I will rinse with warm water containing also disinfectant. The same procedure from the farthest end towards the door. Then I will dry the floor using a dry mop. To remove excess water on the floor. Okay, that's all about the procedure of cleaning the floor. Thank you.
Group 5 member, admission 15, 88, 57. I'll be taking you through to do eye dusting. Here with me I have a cockroach remover and a yellow duster. So we'll start with removing the cobwebs and the dust. I start with this side, like this one. Only one direction. Then I dust the wall systematically from one direction to the other one, like this one. Then here you come back like this one. I'm doing this one to avoid the incomplete places of dust, like this one. Then you go back the same way. That's how the eye dusting is done. Thank you.
I'm Maria Gabriel, admission 2024 HM 158208, group member number 5. Here I'm going to demonstrate on how to clean a toilet. With me I have equipment and cleaning agent which I'm going to use while cleaning. Here I have gloves, Harpic, I also have Vim which I will use along scoring pad if there is any stubborn marks or spots. I also have toilet brush, and this one I'm going to improvise them as my cleaning clothes. Okay, therefore I'm going to start cleaning my toilet. I'm going to wear the gloves for hygiene purposes. First of all, I'll start by flushing the toilet. Then after flushing the toilet, I will smear the Harpic. Then I will leave it to soak for 5 to 6 minutes. Then after there, I will start cleaning. I'm not going to use the Vim because my toilet has no spots or stubborn spots or stains. Therefore, I'm going to use the toilet brush to scrub my toilet. I will scrub it gently to remove all dust and stains. I will concentrate with the inner part to make sure all stains are removed. I will continue scrubbing it gently to leave it clean. Then after there, I will flush it to allow the soap to go away. Then after that, I will take my clean cloth, wipe. I will wipe gently to remove the water, to make sure the toilet is clean and dry. I will concentrate on the boiled part Then after there, I will also clean the cover or the top part of the toilet. I will continue cleaning it until it is clean and ready to use. Then I will clean the top part gently, remove all dirtiness. As you can see, my toilet is clean and ready to use. Then I will pack my detergent and equipment and return them to the store. Thank you.
I'm Mary Jero, admission 2024 HM 158 to 37. I'm a group 5 member and I'm going to demonstrate wall. And a wall is a structure that divide the building. And with me, I have the equipment and agents, cleaning agents, which I'm going to use. And before I start, I'm going to put on my gloves, since I'm dealing with a sick room, which is have a lot of infection. So I'll start by putting in my cleaning gloves, and then I will introduce my equipment. I have the cleaning basins with me. We are going to improvise this. We are going to improvise this as our cleaning basins. I have a basin with warm soapy water, warm water, and cold water, which will be used for rinsing. And in my warm soapy water, I will also add the disinfectant, since it's a sick room. I have my cleaning agents, whereby I have my disinfectant, I have my cleaning agent. Okay, I have my dry cloth, which I'll use to clean the wall. I have the brush for skirting. I have the mop, which I'll use to dry clean the wall after for mopping any spillages that will be on the floor after cleaning the wall. And also I will dry the floor around there. And I'm going to start by adding the disinfectant in my warm soapy water. Then I will start by cleaning the wall using the I will use a hair stroke method using going down. I'm going only to clean this portion which I have selected. I'm doing this to ensure that there is no stain left. Then I will use warm soapy water. I'm going to use warm water to rinse my my wall to remove the soap. I'll still use the same procedure. Then I will final rinse with cold water. This is to ensure that my wall is stainless, spotless clean. Using the same procedure. Then I'll first of all dry my wall, and I'll start from bottom going upwards. This will ensure that there will be no stain left or watermarks. And that is my wall, very clean, spotless clean. And
the room for the sick person. So with us here, we have a table. This table is meant for the doctor. This person is sick, so the doctor will be coming to check the sick person on a daily basis. So the doctor will be sitting here. With us, we have the doctor's coat, and then we have some medicines here. We have syringes, and then we have an apparatus there to do to measure the pressure. Also, we have another one there for the temperatures. And then we have mask here for the doctor because this person is sick, to avoid infections. We also have some gloves here that the doctor is going to use. And then on our bed here, we have laid the bed for the sick. So this is how you are supposed to do. Number one, the bed for the sick is supposed to be lifted up. That's why you can see this is not straight, so we have lifted it up at least here. And then you're supposed, on the mattress, you put the blanket. And then after you put the blanket, you're supposed to put the sheet. And then after you put this sheet, I'm sorry we never got the blanket, but we have the sheet here. And then you're supposed to be, after you put the sheet, you're supposed to put the Macintosh. The Macintosh normally prevents any liquid to go to the mattress. So we have improvised a Macintosh here. And then after you put your Macintosh, you're supposed to put the drawer sheet, because now the patient will not lie on the Macintosh. So this is our drawer sheet. And then from there, you can have another sheet here, and then you have your blanket. And then you can have some pillows here, because most of the time the patient is on the bed. So sometimes he wants to sit down, you can support with the pillows. With me, I have some slippers. Maybe the patient wants to move out and in. That's why we have put some slippers here. And then we have some fruits here for the patient to take. Remember, the person is sick, so this is for the nutritional purposes. On this side, we have some medicines here. This person have been told maybe to take this medicine, so the medicines are here. On my right hand side, we have put some motivational stickers. There is one there that is telling the sick that as we are just treating, he should trust in his God for the healing. And then we also have this one here. We are wishing this person to get well soon. Of course, somebody is sick, he's feeling pain. We don't want the person to feel pain for a longer time. So this person will not spend all his time or all her time on the bed. So what happens? Sometimes he or she will be moving out. So on our side here, we have a seat and a table here, that whenever the person is not on the bed, he's seated here. And then on this table, we have put the flowers. These are fresh flowers, at least to motivate this person and also to encourage this person to get well soon. On my other side, I have the gown for the sick person. So sometimes the sick is here, he needs maybe to keep on changing the clothes. Maybe the clothes are dirty, like that. So we have a gown here, he will change into that. So this is our room, and we believe and we wish our patients to get well soon. And then we also have the dustbin. We have the dustbin there. This is the room for the sick. So we have so many maybe things to throw away, cartons for the drugs and all that, and the used gloves. So they will be placed there. Thank you very much.